I'll tell you a little bit about myself. I'm Arian. I am the CEO and founder of MyCanna and Alysida Health. I'm a MIT grad in molecular biology, and I've spent the last 5 years as a chief science officer in the wellness industry. I will share my screen and then tell you a little bit about how we created MyCanna and what our business development to date has been. Is my screen sharing all right?
Yes, you're great.
Okay, great. So as the CSO of a couple wellness brands, I realized really quickly that our brands spend a lot of time guessing at the consumer's needs, whether that's the company itself, the distributor, or the wellness specialist. We see a huge boom in the wellness industry. New aisles popping up in every major store, pervasive marketing and branding that the wellness industry is selling us, new products with the newest molecules on the block. And I wanted to create technology that could bridge the gap between my supply chain and the end user. I needed to give us a decentralized means of sharing critical supply chain information about our personal sourcing of wellness products and our personalized health factors related to our biology and our endocannabinoid systems in real time, so I could build infrastructure for at-risk communities with higher rates of disease. Being an Afro-Puerto Rican with an MIT degree in the wellness industry made me really cognizant of disrupting stigma around plant-based APIs in women's health. I'm from a community that's generally more accepting of a holistic care, and so I quickly realized the larger public and personal health implications, as well as safe and equitable access to these products. As the industries grow and move into opportunity zones or least developed countries for tax incentives, capital gains incentives, cheap labor, consistent clientele, lower production costs, I wanted to make sure that I was enabling people to understand their supply chain so that they can communicate, vet, and share data about their personal and public health concerns related to the products they're using. And that's how MyCanna was born. Am I on full screen?
Not quite yet. You're on a half screen.
Here we go.
Yeah, there you go.
Okay. So MyCanna, at its core, is a supply chain management platform that uses advanced data analytics and product customization for the consumer packaged good industry. The problem we're addressing is that consumers need a way to interact with products that they're using in the wellness industry to track their experience and effectiveness over time in a science-driven manner. And businesses need a way to authenticate products, prevent fraudulent products from entering into their market, track supply chain, gauge customer feedback, and better communicate with the consumers to build projects and products that actually fit based on consumer need and not marketing assumption. So our solution is MyCanna. MyCanna offers consumers an interactive product tracker through our QR system that allows you to track your experiences with products and biologics and where they've been in the supply chain and if those products actually fit your needs, from a lifestyle and experiential thread all the way to biological functions. Businesses are provided a way to get advanced consumer data and tools to customize and make better products with their consumers, essentially enabling customers of their products to become product influencers in their vertical. How do we accomplish this? We do this with this very simple business model where we work directly with supply chain stakeholders across the vertical. Why I started with MyCanna, it's short for My Cannabinoid System. It means that we are all born with an endocannabinoid system that's affected by tons of products, and it has a role in so many biological functions. And when I say new molecule on the block, we can think of the boom of the CBD industry as one point of reference. Now we have the government saying, troops can use CBD. We have CBD in aisles across our Walmarts and every CVS. And how do we know where that product came from? How do we know how will this compound interact with my biological system? So we work with people all across the supply chain, from the raw material producer to the end user. And we conduct our supply chain exchange through our QR platform. So we put our QR system onto raw materials, onto consumer packaged goods. Consumers can then scan to get supply chain information, chain of custody information, certificates of analysis, and they'll be able to upload data based on their genomics, epigenetics, and companies, are constantly trying to personalize our treatment and our wellness. Companies like Biome and 23andMe and Ancestry all are trying to help us navigate our personalized health concerns. And so by actually associating our code to the product, we can facilitate a consumer feedback loop throughout the supply chain stakeholders. So we have a data marketplace where data from the consumers and supply chain stakeholders, the agriculturalist or the brand, can exchange in our marketplace for a monthly fee. And then consumers can get directed product recommendations, and brands can get real-time feedback that can make their products better. This enables MyCanna to make better products with our supply chain stakeholders. The total available market is about 603 billion if we compound the US nutraceutical industry and the industrial hemp industry. And what I also like to talk about when we think about why MyCanna or our cannabinoid system, it's anytime you have a cavalactone, echinacea, those all interact with your CB1 and CB2 receptors, which are fundamental parts of your endocannabinoid system. So we need to think about, where is my echinacea coming from? How is this going to affect my general health? What country of origin is the raw material coming from? And this is really important as we think about the conflicts going on globally in terms of supply chain management with China, which is the largest industrial hemp producer. So our direct competitors and indirect competitors, in our direct competitor category, we have Cost DNA and Versed, Lucid Green and Veritrace. And why we consider these sort of direct competitors is that they help people navigate personalized health concerns related to compounds in the products that they're using or biological actives. And Versed and Veritrace really capture our supply chain functions, which are, we want to protect the consumer from fraudulent supply chains and bad actors. Our indirect competitors are 23andMe and Ancestry. And why I talk about these companies is, when you take this test, Ancestry and 23andMe aggregate your genomics and sell it on your behalf. You never benefit from that data exchange. And what we're doing is we're putting the power back into the consumer's hands. And so we're currently raising our first outside round. We put about 2 million into our platform to date through our tech partnership with Kudelski, and we're raising 4 million. We have quite a few really large pilots that we've just signed actually this week. We're labeling over 600 farms in South Africa and the raw materials for the biopharmaceuticals downstream. I think my team, Chalisa Clark and Travis Golrud. Chalisa is my head product developer, Harvard undergrad, Harvard MBA. Travis Golrud is our chief finance officer. Our chief operating officer, Cynthia Hines. Dr. Zohalia Zadran and Dr. Anjita Pathamanan both lead our telemedicine and our digital health initiatives. Mariana has been an invaluable advisor to our team over the last 5-6 months. Dr. Manu Platt is our head science advisor. Aaron Rosado, an MD PhD scholar at Georgia Tech and Emory, is our chief tech officer. And Kalichi Nwaso is our head of product development for nutraceuticals. We have partnerships in place with Kudelski Security, MIT, and Georgia Tech, along with a plethora of other universities through our new initiative in South Africa. And MyCanna is the core technology behind Alysida Health, which we do the same process of supply chain management for COVID-19 tests. And this is a nice slide to show the application of decentralized supply chain management.